Here is your stem.
I'm ready, ma'am.
Okay, both ready?
Yes, ma'am.
All right, so if you've read and understood considering it communication skill station, please begin.
Hello, I'm Dr. Ali Hayat, one of the surgical doctor. May I know your name, please?
My name is Adam.
Nice to meet you, Adam. I've been asked to talk to you about an investigation that we would like to arrange for you. Can you please tell me what do you know about it so far?
Doctor, actually, one of your consultant advised this investigation to me. Actually, I am having this difficulty in my swallowing, and there is some saliva is coming out from my mouth, and he advised me
Okay.
to do this investigation.
Okay, actually, this is called esophageogastroduodenoscopy, abbreviated as OGD. And in this, we use an endoscope camera inserted through your mouth, down to your food pipe, then to your stomach, and then to the first part of your bowel. Here, I will show you drawing on this page that how this camera is inserted through the mouth. And okay, so this is food pipe, this is your stomach, and here you say is mouth. This would be inserted through the mouth down to the food pipe, then to the stomach, and then to the first part of your bowel. And this camera would be relayed to a TV screen for us to see the inside of your inside the lining of your food pipe, stomach, and first part of bowel. And we would also do a widening of the narrow part of your food pipe, which was previously determined on the barium image. And we may also take a tissue sample from the lining of your food pipe to determine the cause of your condition.
Doctor, is this procedure is painful? Do I have pain during the procedure?
This procedure is routinely done under sedation, and you will feel a little drowsy and feel no pain.
But doctor, your consultant told me that this was done under full sedation or something. I don't know. Maybe you are confused.
Well, this procedure can be done both in full unconsciousness, that is called general anesthesia, and it is also done in a slight sedation when you feel drowsy and feel no pain. And in your case, we have decided to do it under light sedation.
Okay, doctor. Is there any risk for this operation?
Uh, or like every procedure is not without risk. The risks of this procedure include damage to your teeth when we introduce the camera, or chest infections, or there could be some bleeding from the point where we take the tissue sample, or in a serious complication is cutting through the wall of your food pipe that may require surgical repair.
Oh my God, doctor, I don't want to do this operation. You are going to cut my food pipe?
Listing all these complications does not mean that that will essentially happen to you. I would again advise you to consider this investigation because it is crucial for the determination of your cause of difficulty swallowing. And you must know that these procedures are performed by skilled and experienced surgeons who perform multiple of these procedures.
Okay, doctor, can you please tell me that is this cancer?
Well, it is too early to say that because we will have to wait for this investigation, the result of this investigation, and we might also will have to perform some other investigations to reach this conclusion of diagnosing cancer.
Doctor, why I keep salivating? This is very distressing for me. You see, my saliva is coming out from my mouth.
This is probably due to the narrowing of your food pipe that is hindering the regular secretions to go down smoothly.
Okay, doctor, can you please tell me that when the results of this investigations and the samples will come out?
Thank you. I can understand your apprehension. I can assure you that after 2 weeks, routinely the results come out after 2 weeks, and I'll make sure that as the results arrive, I will contact you through phone call.
Doctor, do I have to stay in the hospital?
You can be discharged usually after 2 to 4 hours after this procedure. We discharge the patient as they're out of sedation, but you will have uh, to have someone to drive you home because you won't be able to drive for at least 24 hours after this procedure.
Okay, doctor.
Can
Okay,
you
to summarize,
can you suggest what should I be eating around the time of this procedure, OGD?
uh, at least 4 hours before this procedure, you can take liquid, and 6 hours before this procedure, you can take the last meal.
And avoid hot drinks,
Yes.
alcohol and hot drinks. And okay, now,
To
doctor, do
summarize
you
what we have
think
been through,
my smoking and drinking habit has caused it to be cancer?
there is possibility of uh, I won't say cancer, but until we reach the result of this investigation, that it is cancer, I can't say it for with confirmation. But generally speaking, smoking and alcohol can lead to the formation of cancer in the food pipe.
Doctor, if
But
your biopsy showed that I have cancer, how would you manage me? What would you offer?
well, for that, we would need to do further investigation like CT scan to stage the disease.
Good.
And
And
according to the staging of the disease, there are multiple options that we can give you. Either we can
after
perform
discussing in MDT. Yes.
after discussing in MDT, yes.
Good. Good. And now you can summarize.
To summarize what we have been through, I would we are likely planning an investigation for you that would include using a camera and called an endoscope and insert it through your mouth down to food pipe, stomach, and duodenum, and widen the narrow part of your food pipe, and also take a tissue sample. And I have also listed the risks and possible complication that might develop. And if you agree, you please sign this consent form.
Okay. I'll sign the consent form. Good. Thank you.
Thank you so much.